Hi everybody and welcome to Cope with Hope. Today I'm going to be interviewing Dr. Avan Dadina, who is a gynecologist and obstetrician with the Breach Candy Hospital. She's an expert in her field, and I asked her if I may interview her to find out a little more about pregnancy and childbirth during this time of the lockdown. So I'm going to get her on now. Waiting for her to connect. Hope everyone's doing well. Waiting for her to connect. Hi, Sairam. Hi, Avan. Thank you so much.
Hello, hello. Hi.
How are you?
Good. Thank you.
Thank you so much for agreeing to tell us a little bit about what's happening with pregnancies and childbirth at this time. It's something that has been on my mind a lot the past few days.
Tell me, what can I help you with?
So, firstly, when the lockdown happened,
Yes.
what is it that happened with people who were already pregnant or people already in the hospitals?
So, when
What
this,
happened with that and safety and
yeah,
things
so
like that?
well, basically, we did have a little bit of panic situation when the lockdown began
Yes,
because, rightly so, mums who were expecting didn't know what would happen.
yes,
But we have managed to handle this, I would say, well,
yes,
because at least at Breach Candy Hospital, we foresaw the situation and had the situation well in control. We
yes,
kind of isolated out the maternity ward, and we had a system put up where the COVID patients or the suspect COVID patients who were not tested would
yes.
come to the opposite ward and therefore not contaminate the actual maternity ward till they
Okay,
were either tested and proved positive or they were kept in the other ward if it was not so. So we
okay.
have managed to isolate the problem and keep it well under control. And even today, we have the situation where they're segregated aside. So to give you an example, we are basically testing all mums by the time they reach 36, 37 weeks. So we're prepared with a negative report. Therefore, we are in the clear. But if a patient, for example, this morning I had a patient who was carrying twins, and her water bag just ruptured at 35 weeks. So she came in without a COVID test. So
Yes,
what we did was we take them to a different operation theatre, deliver them separately, awaiting the COVID test. If her COVID comes negative, then she'll be put back into the regular ward. And
yes.
if it, God forbid, comes positive, then she's in the other ward. So we've got a
Okay.
very good system in place.
Okay, that's heartening to know. Also, thank you so much for working during this time. I mean, we really have to be grateful to all our doctors and medical staff for looking after all of us so well, in spite of putting your own lives in danger. Actually, going every day into the hospitals, and really appreciate it.
I'd like to comment on that because as an obstetrician and gynecologist, we have the option of checking our patients and we're not as much as risk as the physicians. It's the physicians who are really exposing themselves, are at risk, are getting COVID positive patients who they're treating.
Yes,
When we do, for example, if we do a cesarean for a COVID positive patient, you're fully prepared, you go in with your people and
yes,
you update and you
yes,
come out off. And the story is, say, maybe 2 hours. But
yes.
believe me, 2 hours in that PPE suit is enough to make you into a puddle of sweat. And when
Oh
these
dear.
physicians are on an 8-hour duty in that PPE,
Yes,
my hat's off to them, really, because you're wearing 3 layers of clothing, out of which one is plastic, the hood.
Yes.
Breathing is difficult, and it's really very tough for them. So I would say more than us is the physicians who are getting
Yes.
the short end of the stick.
Yes, so we really are so grateful to everybody. I think so much about all our medical staff and what they do. And when I called you the other day, you were in a meeting in a COVID meeting. So you have regular meetings. The hospital, the doctors have regular like Zoom online, or how do you have the meetings?
So we actually have to keep revising our strategy.
Okay.
We did have different directives from the DMC regarding management. At
Yes.
first they had said test everybody, then they said no, please don't test everybody.
Yes.
Then they said test only pregnant people, dialysis patients and chemotherapy patients. So
Yeah.
till they had a system in place, our orders were changing. Plus,
Yes.
we also, adapt on a day-to-day basis with the problem that you get that day.
Yes.
And we have to also look after, see, we don't have one patient, we have the mom and the baby to take care of.
Yes.
So we do meet regularly, practically every, I would say, alternate day, or if there's a crisis, even twice a day, to decide what we're supposed to do, how we take it forward. But on the whole, I'd say we are coping. Not bad.
You are cool. And tell me about mothers. What sort of frame of mind are they in at this time?
I think it all depends on how you counsel them, how
Yes.
you give them the confidence, and you give them. Don't worry, we're there for you, we're looking after you. Every
Yes.
mother is anxious, COVID or not COVID, as she comes to the end
Yes.
of pregnancy and as she's ready to deliver. Especially a first-time mother is, what will I do? Will I be able to do this? How will I do? Is a normal thing. But with this
Yes.
present situation, you have to be far more compassionate. You have to be far more, answer a lot more questions.
Yes.
And explain to her and give her the confidence that no, all will be well. We can
Yes.
go through this together and come out positively.
So do you find you have to be there more for your patients and what they're going through with compassion at this time?
Absolutely. The only thing that I get faced with is mum wanting to keep a japa at home or a nurse at home. And
Okay.
that I am at the moment discouraging.
Yes.
Because this person is a outsider coming into
Yes.
your home.
Yes.
Even if you know where she's come from, still it's putting your newborn baby and your whole family at a little higher risk having
Yes.
a stranger in your home.
Yes.
From that point of view, I am discouraging mums from having outsiders.
Okay. And when they're in hospital, when they're at the breech candy, what about like the family visitors and all? Is that like not allowed, right? I'm happy to hear this.
It's quite sad actually, because
Yeah.
earlier we used to take the husband even into the operation theatre for the cesarean
Yes.
to be there at that moment.
Yes.
Now we are allowing the husbands into the delivery room, but definitely not into the theatre. And only one family member who comes in with the patient is allowed to be there. Not allowed to leave the hospital. They come in together, they leave together. So it's not like
Okay.
I can go home, take a shower, come back,
Okay.
So
Yeah.
we keep them there and then both of them leave together. And we are facing this problem because some of the families, the patient prefers to have a husband, and some families, the mother prefers to be there.
Yes.
They have to make a decision. If the mother insists on coming with the patient, the
Yes.
husband will come in.
Okay. So one person that comes in with
Absolutely. Yes.
and what do you do when there's like a birth where the child then has to stay in the hospital longer? How is that handled, doctor?
So the premature unit handles that.
Okay.
So have a preterm delivery. As I
Yes.
told you, had twins. Now
Yes.
the baby will have to stay for a little longer. So what we do is we keep only the mother, and
Okay.
fortunately with Skype and all that, patients, or what do you call that, FaceTime,
Yes.
you have to, everyone is being very understanding. When you
Yes.
fathers that look, we can't have so many people around. It's surprising, but patients are rising to the occasion and being very, very cooperative.
That's really good to hear. That's really, really good to hear. And Doctor, what do you see as the way forward from this? Okay, fine. Now, today again, there's a new article that's coming out that said that we're going to be in further lockdown and quarantine with stricter rules for a while. But eventually, we are going to get out of this. What do you see now as the way forward medically?
So at the moment, I would say it's not going to go away in a hurry.
Yeah.
And I see this becoming almost a norm of life, I would say, for the next 3 to 4 months. Because as soon as you relax, the cases seem to escalate. So
Yes.
there is no point in relaxing and having further fatalities or mortality. It's better to be careful, to play bad guy, and make sure that the strictness is maintained,
Yes.
rather than make it relaxed and then have more cases coming up and it's spreading further. So I don't
Absolutely.
see it going away. I would even say up to 6 months.
Okay.
In
So,
the hospitals, we're going to have to be very strict for the next 6 months.
yeah.
You
Yes.
can't have people, we're not even doing OPD consultations in the hospital, we're doing them by video calls.
Oh, okay.
Yes. Only people who have to be examined or people who have to come in as an emergency, and then we screen them before taking them into the hospital. We have a triage area where they are screened and then allowed in. Again,
Okay.
the accompanying person has to wait outside. So even if it seems a little heartless, it is for your own safety.
It doesn't seem heartless. It seems like with a lot of care, actually, because it's doubling and tripling the work for you as doctors, as for the nurses, and for the hospital.
And people don't realize that you can be an asymptomatic carrier and
Yes.
come in with every good intention, but lead to problems.
Yes.
So
Yes.
if the wife is positive and the husband is positive without realizing that he's positive, asymptomatic, and he
Yeah.
accompanies the wife inside, then again you're putting more staff at risk. And some of
Absolutely.
these patients are little difficult to deal with. The moment you leave the room, they take off their mask. In fact, this morning I had a little bit of a run-in with a patient, and I said, if you don't wear your mask, I'm not entering your room.
Very good.
Because you don't know, you could, in the testing also, there can be a false negative.
Yes.
So you have to continuously be very, very careful. You can have
Absolutely.
we had a case who was put for a cesarean. 7 days ago, she tested negative. Because her pregnancy continued, we retested her at the end of the 8th day because she hadn't yet delivered, and her second test came positive.
Oh, God.
So then that puts you again at a risk. So positive or negative, your complete protection has to be in place 24/7, and we're on our toes with protection.
Yes. So, what do you do when there's a birth with somebody who's positive? If they need a cesarean, if what happens then, doctor?
In fact, the recommendation is that if that's a positive patient, it's better to do a cesarean
Okay.
because you can control the dissemination. Whereas if it's a natural
Okay.
birth, with all the breathing and the pushing and there is more
Yes.
aerosol distribution. But we have
Okay.
done positive births also, and we have done positive cesareans also. It's something that one has to
Okay.
deal with. You can't say, oh, you're
Wow.
positive, you can't deliver, you remain pregnant.
Wow. You guys are just heroes, I tell you. Wow. And tell me something. What are you doing for your own personal safety?
So Me and my family. I have a husband who's a
Yes.
diabetic, hypertensive, so I've been on edge. Well,
Yes.
basically, leave home looking like something from outer space.
Yeah.
I have my head covered. Yeah, we have our head covered, our mask in place, and our protective goggles
Yes.
and gloves. Then we reach the hospital and change into hospital clothes. So you don't
Yes.
wear your street clothes inside. And you
Yes.
finish your rounds or your surgeries, whatever. And again, you change back. In spite of not wearing your clothes, you come home straight to the bathroom and have a bath.
Okay.
So the outcome is about 3 baths a day, but that's all right.
That's all right. And what else do you do for your own personal? Okay, now I'm going to just chill a bit.
So I like to read, and
Yes.
I would say that in a way, this has given me time to listen to the kind of music that I like to listen to. And
Oh,
I like it
lovely.
classical. So I'm listening to opera loudly, much to my neighbor's discontent. I'm
Yeah.
actually, I even discovered Netflix
Wow.
and I watch movies. I mean, so I have my time. Plus, it's given me good
Lovely.
time to read up on.
Okay, great. Doctor, what is the word hope for you personally? What does the word hope mean for you personally?
Getting a vaccine to curb the spread of this and getting people not to get infected with this. This is what I really pray for every day. That the sooner we overcome this and put it behind us, it's going to be better. There's another side to
That's
it
right.
which occurs to me is that in
Yes.
the way when I look out and see the blue sky and the quiet and hear the birds chirping, I see what we've done to not have all that when lives were normal. So
Yes.
there are two sides to it, and we should find the via media where we don't have
Yes.
go back to all our old ways of living and still
Yes.
respect nature and still live with nature, which we've forgotten to do with all the
Absolutely.
building and the rampant industrialization and only wanting to achieve whatever you may say. I don't want to
Yes.
say it, but I think that it would be good if man found a middle path.
Yes. So beautifully said. And any last minute advice that you'd like to give to people out there for their
I would
safety,
say,
for their mental
please be
health?
careful.
Yes.
I would tell everybody, don't be fearful, be careful. Be safe.
Oh, yeah.
Don't think that it can't happen to me. Even if I have patients saying, be careful, try
Yes.
to cover your head also when you go outdoors and just be very vigilant of where you're going, what you're touching, and safety is much better than saying, oh, I got it. So if you are careful, you don't have to get it.
So be careful when you go out. Don't get lax about it. Wear a mask, cover your head if you can, and be super careful. Thank you so much for taking the time out to talk to me. And I do hope that you all are safe, you are well, and really you are our heroes.
Pleasure, Nandini. You know what? You have done a great service because the more this reaches out to people to tell them
Yes.
not to panic and be careful, you are doing the
Yes.
service. Really.
Thank you.